And I was just really let down from the medical establishment. I had like an early intervention with the medical establishment that just left me so disappointed and without answers. And so it really set me on this path by the time I was 16 of looking for answers on myself and seeking out other alternative methods. You won't get the dramatic effects that you see with children where it completely changes their faces, but you can still correct the function so that you are more functional, so that you don't have this exacerbation of symptoms. And that's really what we're after as adults, is getting rid of the symptomology, right? We don't want to feel fatigued. We don't want garbage sleep. We don't want to be in chronic pain all the time. We don't want to feel anxiety, chronic stress, panic disorder, all these things. And this is part of the root cause of all of those things.
Hello and welcome. I'm Sarah, and today's guest is Tara Bianca from Be Light Transformation. Tara's going to share her experience and expertise in breathwork, biomechanics, and posture to explain how this is really important for mental and emotional states, as well as physical health, sleep, snoring, and attention. Tara's going to walk us through some methods which you can use to get rid of sleep apnea, snoring, problems with attention from bad sleep, and other postural issues that can cause pain and discomfort. We also discuss carbon dioxide tolerance and carbon dioxide's link to oxygen, and how you can use controlled breath holding to improve athletic performance and also metabolism, because this kind of breathing can help with something called the superoxide surge in the mitochondria. If you want to reach out to Tara, the links are in the description. Also in the description are links to my courses, how to get in touch with me, and also my Substack on quantum biology. Welcome to the channel, Tara. It's really nice to have you on. Do you want to introduce yourself and let people know what we're going to be talking about today? Because I discovered you through a friend because you have a wonderful video on breathing and carbon dioxide. I also read all about you. And as I was telling you before, what really resonated with me was the fact that you used to be really, really shy and introverted. And you basically made yourself ill from, we were talking about having living in a fear mindset, and then you've come sort of so far and you have all these wonderful tools to offer.
Yeah, Sarah, first of all, thanks for having me on. I'm a really big fan of your work as well. And yeah, so about me. So my name is Tara Bianca. I own a company called Be Light Transformative Therapy, which aims to use breath work and body work techniques and sound healing to sort of transform the body from the inside out. I've been taking that holistic approach for a long time. Um, yeah, I don't know where to begin. I mean, my healing journey kind of started when I was a preteen. Uh, it started to crop up as sort of food sensitivities, really. It started to crop up as food sensitivities and a lot of gut dysbiosis. And back then, this would have been in the early 90s. We didn't know anything about the gut microbiome. We didn't know anything about microflora. We had no idea. We really didn't have the language for speaking about the gut like we do today. Um, and I was just really let down from the medical establishment. I had like an early intervention with the medical establishment that just left me so disappointed and without answers. And so it really set me on this path by the time I was 16 of looking for answers on myself and seeking out other alternative methods for healing yourself. And it's kind of never really stopped. So like you said, as a kid, I was very shy, painfully shy, no friends, no sense of belonging anywhere. Um, and just really like a lot of emotional pain that I carried for a very long time, just feeling very alone. And that was making all of the physical symptoms worse, right? So I had a real understanding from a young age that my emotional state and my mental state were perpetuating this manifestation of physical illness. Um, and so I think when you learn that at a young age, when you draw that connection at a young age, it really sparks you to keep asking questions and to keep seeking answers. And so I kind of went through this very generic process of looking into food healing was sort of my first gateway in. I was always very interested in fitness and movement. But these physical, it was like I was trying to treat an emotional problem with physical tools, and it wasn't getting the job done. Using food and movement were a great starting place, but they really weren't accomplishing what I wanted them to accomplish. So I kept searching. And eventually, things like breath work, like sound healing, which are a little bit more transient, a little bit more intangible, and maybe a little harder for us to understand logically and reasonably, are the things that start to have the greatest impact. Because again, I think the tools are meeting the problem at the same level. And so it's just a better match for finally starting to overcome some of these emotional issues, if that makes sense.
Oh, absolutely, because I think sound is massively underestimated because I'm really into sound baths and tuning forks and sort of nasty sounds from the outside, but then obviously things like humming and chanting and things like that for the vagus nerve. And of course, breath work is a huge sort of topic. So which one did you discover first, sound or breath?
Well, it's really interesting. So I'm sort of an amateur musician too. So I've always played music from a little kid. And if I'm honest with myself and everyone else, I always wanted to be a musician. And I still have that deep inner urge. It just never manifested. So I think I always went to sound, sometimes in the form of music and just sometimes in the sound of listening to nature, as a self-soothing technique. You know, I think a lot of us do that when we're younger naturally without realizing it, just listening to insects, listening to birds, you know, like getting in touch with that nature frequency. So I definitely discovered sound first, I would say, from just this natural organic path that I was on. And then the breath work, you know, it was always sort of there, but it was flying under the radar. You know, like I'd do my yoga practice or I'd have a qigong practice, or I was a manual therapist for most of my career. So we'd be working on the diaphragm and working on the muscles of the throat and working on the face. But I never really tied the pieces together to really hone in on the breath as my main focal point until quite recently, in the last probably 8, 10 years, you know. And once you go there, you realize, oh, like, how are we not focusing on this? You know, breathing is literally the like, it's like the functional unit of life, right? Like nothing lives without breathing. So yeah, then you realize, wow, when I start to focus on my breath, this has a trickle up effect to my emotional health, my mental state, what's going on in my nervous system, how resilient and adaptive I am, how I manage stress in my life, and the physical manifestations of pain and dysfunction. And so once you have that recognition, it causes you to go deeper and be more disciplined with your practice because you really start to feel those benefits.
Okay, so if you want to walk people through maybe some basics of, because you mentioned breathing anatomy, because I used to do manual therapy as well, and obviously tight diaphragms and tight ribs and tight shoulders, but then that's obviously a consequence of poor breathing mechanics. So maybe if you want to walk through the sort of outside aspects of breathing, and then we'll go into the carbon dioxide afterwards.
Okay, yeah. So when I teach about functional breathing, I usually divide it into 3 categories. And I think this is pretty standard across the board right now. So we have the breathing mechanics, which you just said. So the biomechanical aspect of it. We have this biochemical aspect, which is this oxygen CO2 exchange, which I guess we'll get into. And then there's also, we consider this psychophysiological aspect a part of functional breathing, quite honestly. How is our nervous system impacting our breathing, right? How is our thoughts and our feelings impacting our breathing essentially? And that's sort of a bi-directional relationship as well. So the breathing mechanics, just what you said, you know, most of us are walking around with really poor posture, really slouchy posture, really poor neck position. A lot of people are walking around with a tongue tie. And when the tongue doesn't have good mobility or good function, it affects the position of the cervical spine. You'll see a lot of people getting stuck in this forward head position. When we have the forward head position, we're putting a ton of pressure into the brainstem, right? So we're having all these neurological responses to that, and it trickles up and down. So the nerve that innervates the motor nerve that innervates our diaphragm comes from our cervical spine, right? Our phrenic nerve comes from the cervical spine. So if we have any dysfunction of the cervical spine, it's automatically going to have an impact on how our diaphragm is performing. And then if we're slouched in any way, if we tend to hunch over, or even if you're too sort of erect and pulled back in that military posture and you create a stiffness through the rib cage, the diaphragm can't get its leverage to do its job. So you're never getting that full inhale and you're never getting that full exhale. And it's causing your breathing to become dysfunctional, usually, which means it's getting more shallow and too quick, right? And this has consequences going forward when we're constantly in a mild state of chronic hyperventilation, essentially. And that starts to trickle. So then the breathing mechanics start to trickle into the breathing chemistry, right? Because we're not getting that breath in optimally. And so we're not getting our optimal gas exchange. And now this has trickle-on effects for our oxygen consumption and our ability to produce energy, and whether or not we experience stress and pain, right? So it has this trickle-up effect. So with most of my clients, I do start with the mechanics, because if the body is off and you can't even get that deep functional breath, and you can't get that good oxygen, carbon dioxide exchange, it's not even, there's really no point in even touching the rest of it, right? We got to kind of get the body stacked first, I think. And then, okay, now what can we do? Did that correct the biochemistry of the body at all? And if not, now how can we address the biochemistry separately, basically?
I'm so glad you mentioned all of that, because with the head posture, it also loads the lumbar spine. And then I remember when I used to teach movement, I used to talk about the diaphragm and the pelvic floor, and then the membrane in the head, or people would say the sphenoid, are all meant to be going up and down. So I think people think of breathing as just chest, but then, you know, it's, as you would look at it as well, it's sort of a whole body sort of coherence or coordination. And I love the way you mentioned also the forward head posture, because I'm sure lots of people have now sort of put their heads in, but you can't just correct the head posture without correcting the thoracic spine. And then you must even probably delve into foot mechanics as well, because I used to always say problems start at the top and work their way down, or start at the bottom and work their way up. So I think it's really important if we just carry on a little bit on the posture side, because I think people tend to sort of jump ahead and forget the basics, which you sort of very nicely brought up.
Yeah, it's 100% correct what you're saying. So it sounds like you have a bit of an osteopathic background, which I have a bit as well. So in the osteopathic community, we definitely say that you have at least 4 diaphragms. So as you said, the tentorium cerebelli, we have the sort of thoracic inlet, we have our thoracic diaphragm, and we have our pelvic floor. And those 4 diaphragms are working hopefully in synergy with each other to regulate pressure in the body and to transmit force effectively, and to make sure that we are functioning as efficiently as possible, meaning in our standing posture, but also as we move through space. But then, you know, we consider other diaphragms in the body too, which are basically kind of transverse or horizontal planes through the body that are, one, regulating pressure, but they're also sort of a major meeting ground of these sort of vertical highways that are going through the body, right? And so they're really impacting our nervous structures, our vascular structures, our lymphatic structures. So they have a massive impact on what's going on in the body, fluid dynamics, all these things. So we consider the tongue and the floor of the mouth a sort of diaphragm, right? So it's interesting because as I keep teaching this work, I'm very hyper focused on tongue and oral function these days. So orofacial function these days, and orofacial development and growth. So a lot of my colleagues are myofunctional therapists. We're working a lot with tongue mobility and proper tongue function in order to stabilize the upper part of the respiratory tract so that people can actually use their diaphragms, their respiratory diaphragms correctly. And then I love what you said about the feet. So some people also consider the arches of the feet a sort of diaphragm. You know, this is how we make contact with the earth. This is how we propel ourselves forward, both physically and metaphorically, right? How we stand on our feet is kind of how we show up in the world and how we interact with others, and whether we feel safe or not, whether we feel threatened or not, whether we feel confident or not. And so the arches of the feet and how we displace our weight on our feet is also going to have this trickle up effect through the knees, through the hips, into the diaphragm. I have a good friend who is a gait expert, and we've been working together to kind of help people to see, okay, how can we take what we know about the feet and start to incorporate it more into our respiration? So how can we coordinate our breath during every point of the gait cycle? So you can really go very deep with the breathing mechanics from a full body perspective, as you said, Sarah, from the feet up and from the brain down. And you kind of need both of them. You know, people can get stuck at any point along the way. And when you can just identify those things and correct them, you can have a massive global systemic change for yourself. It does take some practice though, right? There's like a neuroplasticity element to it. There's a rewiring and a repatterning that can take some time and some discipline, but it absolutely can change everything for you.
Oh, absolutely. I'm glad you mentioned the rewiring, because with the 10,000 repetition rule, because if we take 10,000 steps a day, say theoretically, I know it's a made up number, but you can sort of alter your gait pattern in 1 or 2 days. Again, because we breathe so often, we can actually retrain the breathing quicker than we think, just because of how much we do it. But then, like you said, that it's those two things are important for the repetition, but then actually getting the base structure of the person functioning well. So every time they take a step, it's a good step. So it's reinforcing a good pattern, because you can obviously undo it all really quickly as well with breathing and walking by doing it badly for a couple of weeks. So, it's I'm glad you mentioned that. So when it comes to sort of just some basic sort of movement, what kind of things do you teach or offer? Because I learned all sorts of things from Franklin method to somatics, and there's a whole gigantic world of movement. So what would you say that you're, just so people can have a flavor of what you do in case they want to work with you or find out they're nearby to you?
Yeah, so I work at it from a couple different levels these days. So I've been working again from the top down. I've been working a lot on teaching people better tongue mobility and tongue function. This is something that's really important to me, and figuring out if people have any kind of oral restriction. Because if that oral restriction is there, it really has to be addressed. It's going to have trickle down effects. So working on tongue position and oral functional function, basically, oral facial function. I tend to borrow a lot from Postural Restoration Institute. Are you familiar with them?
No, I probably
Yeah.
would recognize the movements, because with movement vocabulary, you can start to see where something came from. And there's, as long as the form's good, any move, I always say that, any movement is great.
Yeah. So Postural Restoration Institute really looks at the diaphragm as a central component. It really takes the body as being naturally asymmetrical and says, okay, we are naturally asymmetrical because of how our organs are uh, placed in our abdominal cavity. How can we take that asymmetry and make it more functional? And so a lot of things with like feet up on the wall, feeling the heels, really working on the proprioception through the feet, through the hamstrings, through the pelvic floor. Most people are a little bit more flared in their left rib cage. They have more of an out flare, right? Just because the right side has more support, it has that huge liver underneath it to support it. So most people are a little more flared on their left, or you see a lot of people who are hyperinflated. You see this is very common in athletes where both the ribs are really flared out and they're kind of stuck in this extension pattern. So identifying those things and using just these very hard surfaces as reference points, the wall, the floor, to get their spine more neutral, to help them close down the rib cage if it's really open. When we close down the rib cage more, it gets the diaphragm to ascend more into the thoracic cavity, and it improves what we call the zone of apposition. So now you actually have your full leverage to get your full inhale and your full exhale. So really manipulating the bony parts of the body really help to create better breathing mechanics and better breathing efficiency. I also learned something with a very famous French osteopath who just passed away recently called ELDOAS, which is a French acronym, but it's basically about creating sort of self-myofascial release, targeting each specific spinal segment. So it is very, very specific. There's a different posture for each spinal segment. And I love it because it is self-induced and you're kind of pushing to your maximum to get your specific release. And I love that we can target specific vertebrae, because now if you were postural distortions more in your neck, we can really focus on that and get more space for the phrenic nerve, for the vagus nerve, for all these important nerve structures that are innervating the body to create better vascularity and lymphatic flow. And if we're talking about the diaphragm specifically, we can really target the lumbar spine, where the diaphragm connects onto the lumbar spine, and really get more space for those pillars so that they have a better leverage to move the diaphragm. Or you can really focus kind of where the thoracic cage meets the lumbar spine, right? And this usually these weird transition parts of the spine are where people get really stuck. And maybe you find this too, Sarah, from your movement practice, that people are really lacking rotation, especially through their thorax. They're not ambulating well. They're not getting this rotational aspect. And so that's not only impacting their breathing because it's causing kind of a bracing pattern, right? So when we lack that movement, it sort of represents that we're bracing against something. And that can also be psychological. Maybe it's a fear pattern, as you said earlier, or maybe it's just a defense mechanism in some way. We're always preparing for fight or flight. We're always preparing for an attack. That's like a very threatening posture. So I like to really work on thoracic mobility with people and getting their diaphragm to activate a little bit more. It just creates more efficiency in the body, how we transmit force again, so that you don't have these impact injuries just constantly bearing down on the same structure over and over again, creating these pain patterns in the body.
Oh, I completely agree with you about the junctions. I always used to tell people wherever there's a junction in the body, like the thoracolumbar junction or the sacroiliac joint, there's usually that's where to look for one of the problems. But yes, definitely a lack of movement sometimes is brain derived, that you've sort of narrowed it's like a comfort zone, and your brain thinks it can't move that joint in that plane. And then therefore it can't. So the area gets a bit stiffer. Just before we move on, I think this will resonate with a lot of people, because I can tell you really like the head and the neck. What are your thoughts on snoring? Because this is like a big problem for lots of people. Well, I don't, but I think it's, if someone's got a noisy, snory partner, it could lead to a divorce.
Yeah, well, it definitely has that emotional and relationship component. But yeah, the more I study this work, the more I realize snoring is really devastating to your health. It's really an indicator of dysfunctional breathing. So it depends how you're snoring. If your mouth is hanging open and your mouth snoring, this is like we have to fix this immediately. If you are sleeping 8 hours a night with your mouth hanging open and you're snoring and you're choking on your own tongue, you are never getting into deep REM sleep. You're missing out on all your recovery and regeneration. You're missing out on all the healing, and you're never going to get past your chronic pain and your chronic low energy issues. It's a no-go. We have to fix the snoring and getting the mouth closed at night. It is possible to kind of snore through your nose too. And this is more of where we can start to train the breathing for you to be more comfortable breathing a little bit lighter and with a little bit less volume. So we can practice certain breathing techniques during the day, mostly what I would call reduced breathing techniques, where you train yourself to pull the breath in much more slowly, much more gently, but still feel deep enough, and then let it out really slow and gentle, so that a lot of the snoring is just a pharyngeal insufficiency, right? The pharynx is kind of collapsing on you, and the pharynx is more likely to collapse if you're taking in big, heavy, laborious breaths. If you can keep your breathing lighter, those small muscles of the throat are more likely to stand up against the friction. So I think it's a big deal. I think it definitely is underaddressed. I think there is an epidemic of obstructive sleep apnea. It's a big problem. And a lot of us are working now to get people off their CPAP machines using things like functional breathing approaches and all this orofunctional, functional myofascial work that I was speaking about earlier, really retraining the tongue, because a lot of times the problem for people is that their tongue is so weak that it's just collapsing into their throats and choking them off at night. So if we can correct that problem, that's a big deal. And so think about the implications of just, let's say 1 billion people worldwide have obstructive sleep apnea. They're not getting enough good quality sleep. If you can fix that in a natural way relatively quickly, think about just how getting people to sleep better changes the entire sort of tide of the world, right? Now people have a better mood, they're able to show up better for their families, they have more energy, they're more creative, they're more inspired, they're more focused, they don't have the cognitive decline. I mean, it really impacts society on a massive level. They're not as distracted. They can focus on things like driving without, scrolling on their phone. It sort of changes the whole game. People are able to focus on one activity at a time. I think there's massive up level implications for fixing people's sleep, for their personal health, but also for the health of society at large. I think it's kind of a no-brainer that we have to go there.
Oh, no, I completely agree with you, because people don't realize how bad mouth breathing is. And people think, oh, so and so snores, and it's like saying, oh, they've got blue eyes, that they're never going to stop doing it. Whereas I think I'm not an expert in snoring or sleep apnea, but I know there are lots of other causes to sleep apnea, but even children snore. So if people have got snoring children or snoring sort of partners, you would say it's really important to fix it as soon as possible. And there's, like you said, fixing that and will have huge impacts later. I mean, even for children, because I mean, there are so many problems with children and concentration and mental health issues that I think it's one of these things. That's why I invited you on, because it's a neglected issue and people always want to jump to the good bits. And then they're telling me, oh, I'm sleeping exactly as you said, and then they're still snoring. So, it's a
I
big.
love what you just said, Sarah, because probably hundreds of millions of kids are snoring at night or have some kind of dysfunctional breathing pattern. And with them, because they're still so malleable and their bony structure hasn't fully ossified yet, you can make such big changes with kids if you intervene early enough. Preferably before 7 would be great. But even like under 12, you can make such huge change really naturally. My advice for parents is to get them to a myofunctional therapist ASAP. And also think about getting an airway coach, a breath coach to help your children learn to shift how they're breathing. So it's really amazing what you just said. When you can intervene with children, you change the trajectory of their entire lives. So I've seen examples of, I have a holistic dentist that I am friendly with, and she works mostly with children. And she'll post things all the time how without braces, she is completely changing the shape of these children's upper palates and their entire face. So they can have this really crowded upper palate where their tongue isn't even able to make contact with the roof of their mouth. Their teeth are growing and crooked. They have really sunken faces. And through training it over the course of maybe a year or a year and a half, they develop perfect dental arches. The teeth are growing in absolutely straight. They have these beautiful, expansive upper palates. They're now able to make full contact with the tongue on the roof of the mouth. They have a lot of strength and integrity to the tongue to anchor the upper part of the respiratory tract and to also strengthen the integrity of the pharynx. And what happens? What are the real life symptom changes? These kids normally come to her bedwetting, sweating at night profusely. They can't regulate their temperature. They have no focus at school. Most kids who mouth breathe are misdiagnosed as ADHD. Misdiagnosed, I mean, they are having distraction issues, but it's not because there's something wrong with their brain. It's a lot of times it can be an airway problem. And so having a hard time focusing, behavioral issues, difficulty learning, all of those things. And after you fix the oral part on its own, and you get them some space in their mouth, and you teach them how to use their tongue, and you teach them how to breathe differently, suddenly they're sleeping through the night. They're no longer wetting the bed. They're able to regulate their temperature. All the behavioral issues disappear. They're focused at school. They're better able to learn. I mean, this changes their entire life. You just took a problem child and you gave them a new opportunity to be excellent in life, right? Just because you change the simple thing that is not always obvious, but I do think this is a huge root cause for most people, and it's kind of going unrecognized.
I love it that you know somebody that can do all of this without braces, because Dr. Jalal Khan's been on this channel, and he was talking about if you do use braces without correct osteopathy for the suboccipitals, you can actually create a locked-in problem. Whereas if you can naturally allow the teeth to reorganize themselves and all of the structures around them without any braces, it's like a double win. And I'm so glad you mentioned that, because I think obviously it's crooked teeth is a problem, or it's just more corrected now, and people dive in without thinking, I wonder if there's an easier way to do this without having to sort of rush the body and other structures not being prepared for the different position of the teeth.
Yeah, not even easier. There's like a there's like a right way and a wrong way.
Yeah,
I
okay.
mean, but the tooth position is not just a purely aesthetic issue. It's pointing to a dysfunction in the orofacial development. So fix the orofacial development and let the teeth adjust on their own. The teeth are just giving you the warning signals, but it's not an aesthetic issue. This is a functional issue, and it's an important functional issue that affects you for the rest of your life if you don't correct it.
Oh, absolutely. I love the way you said that, the it's not just aesthetic, it's sort of directing you to other problems, because I suppose each tooth is innervated to somewhere else in the body. So if you don't fix the teeth, then you'll end up with physical problems as well. So yeah,
Yes.
that's that's kind of really rocked me to the core. So, and I think it's really important for people to know, I think with children, and then if somebody's already corrected their teeth, well, there's plenty that they can do with you for other facial structures, and not to get too worried about it. But yeah, thank you for pointing that out, because I think it's again something that I wasn't aware that you could correct teeth like that. But like I said, it's not my area, and I think it's such an important thing for people to be aware of that's possible.
Yeah, 100%. I will say, as an adult, it's a more patient process, and you won't get the dramatic effects that you see with children where it completely changes their faces, but you can still correct the function so that you are more functional, so that you don't have this exacerbation of symptoms. And that's really what we're after as adults, is getting rid of the symptomology, right? We don't want to feel fatigued. We don't want garbage sleep. We don't want to be in chronic pain all the time. We don't want to feel anxiety, chronic stress, panic disorder, all these things. And this is part of the root cause of all of those things.
Shall we move into the sort of more biochemistry side of the breathing? I want to thank my sponsor, Lightwater Scientific, who helped me deliver free, valuable information to you and also allow me to have great guests on this channel. Lightwater Scientific produce the purest and most deuterium-depleted water in the world. Depleting or lowering your deuterium has numerous health benefits, from better metabolic health, more energy, greater resilience, less brain fog, increased physical performance, enhanced healing, and healthier mitochondria. Deuterium is an isotope of hydrogen, also known as heavy water, because it's bigger and heavier than regular hydrogen. Even though deuterium makes up only 0.02% of hydrogen, it's found everywhere. Deuterium is a burden to your body because it interferes with the intricate chemical reactions that occur by slowing them down. Deuterium is kryptonite to your mitochondria, and we need healthy mitochondria to produce energy. There's over 60 years of scientific research on the negative effects of too much deuterium on health, and also the positive benefits of lowering deuterium in the body. Lightwater deuterium-depleted water is 100% safe and non-toxic. In fact, it's the closest in structure to the metabolic water that your mitochondria produce. Lightwater deuterium-depleted water comes in 5 or 10 parts per million glass or plastic bottles, so level up your health by leveling down your deuterium today. The purchase link is in the show notes, and use code Dr. Sarah for a discount off your order. Because I think that's sort of for people who've never heard this before, it's quite a sort of surprise.
Sure. I'm trying to think of how to even segue in. I guess we'll start with the most obvious that I think is probably heard about the most often, which is something called the Bohr effect. I think this is like probably the easiest place to start. So how can we begin? When we breathe in oxygen, right, it has to go from the alveoli, those are the little air sacs at the end of our respiratory tract, to get into the bloodstream. And oxygen rides around the bloodstream on hemoglobin molecules in our red blood cells. But how does oxygen isn't doing much for us in the bloodstream. It has to get to our tissues, it has to get to our muscles, it has to get to our brain, to our internal organs, to our heart, right? So how do we get the oxygen from the hemoglobin molecule in the red blood cells out to the rest of the body? There can be some passive diffusion, but what really triggers oxygen to be released from the red blood cells is an increase in CO2. So when the body registers CO2, it says, okay, we got to offload this oxygen, get it to the muscles, get it to the brain, get it to the heart, in order to make energy and, the rest of it. Okay, so that's the basic principle. That's the Bohr effect. The Bohr effect says as CO2 goes up in the body, it allows oxygen to more easily dissociate from the hemoglobin molecules. And the reverse of that is also true. If you don't have enough carbon dioxide in the body, or if your CO2 for some reason is going down, then oxygen clings to the hemoglobin molecules much more strongly and is much more resistant to dissociating and going into the tissues and the organs, the brain, the heart, etc. So how does breathing play into this, I guess? And what are the real world implications of your oxygen either clinging to your hemoglobin or being willing to release and go into the tissues? If you can't get oxygen to your brain, I mean, obviously you're going to start to have focus issues, cognitive issues, memory issues. You're not going to sleep well. You're going to feel foggy. And everything else that the brain controls, which is everything. It could trickle into hormonal issues. It could trickle into neurodegenerative issues long-term over time. For people with cardiovascular stuff going on, if you're not getting enough oxygen to the heart, what's happening? I mean, you're starving the heart of its very precious energy that it needs to pump circulation all over the body. And then if you're not getting it to your muscles tissues, what's happening? You're not able to produce energy efficiently. You're not able to get good contractions. It's going to prevent you from really getting the strength and power gains that you want. You're going to have a harder time generating force in the body. You're probably going to feel very fatigued all the time, and you're probably going to have an overwhelming sense of kind of breathlessness. When there's not enough oxygen being delivered, there's also nervous system issues that come up, right? So the people who are not getting good oxygen consumption, good oxygen delivery, are going to be your people who are more anxious, more prone to panic disorder. They feel fidgety all the time, right? They don't know what to do with their emotions. There's more of an emotional stress component to it. I'm trying to think where to take this. That's sort of the global picture, but how can I refine this for you guys, Sarah?
I think it's always about sometimes it's really good to go right back to basics, because I've been in situations where you're too embarrassed to ask a question that's really basic, and it's nice to just be walked through right from the beginning. So when it comes to dysfunctional CO2 levels, how do people manage to do that? What causes it? Because I know it also impacts the gut as well, and CO2 does other things, but how does it go wrong?
Okay, great. Perfect. Thank you. Okay, so it can start from a number of ways, right? So think about when you're a child, any kind of trauma that you experienced, we know that it has this somatic effect in the body, right? So it can start that way of like my example from my own history of being a really shy, closed off little girl who was afraid to speak, was terrified of judgment, was terrified of criticism, never had any friends because she was too afraid of what they might think of her, right? This is a person who's really closing herself down physically. And so when I close myself down physically, you can see it in the posture, right? When you go out into the world, you can tell who's feeling confident and happy and content in their lives and full of passion and heart centered and open, and who is really in a protective mode and like afraid to connect and feeling shy and embarrassed, like the eyes down, the head down, the kind of avoiding contact. These protective postures, which are nice to have for our nervous system, they make us feel safe, again start to have, so they create this biomechanical issue, what you talked about before, of distorting the neck, distorting the tongue, collapsing the chest, not being able to move the diaphragm at all, which then trickle into the biochemical issues. So how do they trickle into the biochemical? If I can't get that full breath, if I can't get my diaphragm to really descend, I'm never getting oxygen deep into my lungs. So I'm always taking this shallow breath. And if I'm taking shallow breaths, it automatically means my respiratory rate is too fast. I'm breathing too quickly, right? So at rest, we'd like the breath to be around 12 breaths per minute. But you'll find there's people who are breathing maybe even 20 breaths per minute. And they're doing this regularly throughout their lives. That's really dysfunctional breathing. We call that chronic hyperventilation. So what happens when I'm chronically hyperventilating? If I'm exaggerating, if I'm breathing too quickly, and then God forbid if I'm all day panting with my mouth open, I'm blowing off too much CO2, right? I'm constantly blowing off CO2. And so what happens when I'm constantly blowing off CO2 every day, more than I should be, for years and years and years? It actually recalibrates my CO2 levels in my body. So let's say that CO2 is on average about 40 millimeters of mercury in the blood in the average human being. Let's say someone who's been chronically hyperventilating for a while, their baseline CO2 might drop to maybe 35 millimeters of mercury, right? So now they're starting at a lower threshold of CO2, okay? They're starting at a lower threshold of CO2. And what happens when they are blowing off too much CO2? We have this Bohr effect issue, right? So now CO2 is going down, which means oxygen is clinging in the red blood cells to the hemoglobin too much. They're not getting good oxygen distribution to what you said, to the gut, to the brain, to the heart, to the muscle tissues. Okay, so now they're starting to experience symptoms. They're starting to experience gut dysbiosis. They're starting to experience foggy thinking. They're starting to experience aches and pains throughout their entire body. They're starting to feel anxious. The other thing about a breathing pattern like this is evolutionarily, humans would only be breathing like that if they were running for their lives, or if they were maybe trying to get over an infection, if something was really physically wrong with them. If they were sitting around a campfire eating dinner, no one is breathing like that, right? So in our nervous system, this breathing pattern of too fast and too shallow automatically signals a sympathetic response in the body. We're automatically in fight or flight. Whether I'm sitting at my computer breathing like that or not, I'm already in fight or flight mode, right? So how does this happen? So let's go back to chronic hyperventilation. I'm trying to think of where I'm trying to go with this conversation. Sorry, Sarah. Maybe you need to direct me again because maybe I went off track.
Oh no, oh no, don't worry about it because you kind of we're sort of recapping because you kind of covered the mechanics of it. Because sometimes with CO2, people think, oh, do I need to buy a CO2 inhaling machine or should I buy I've read quite a lot of Anders Olsen stuff, you know, a
Right.
mouth corrector or a breathing corrector, or what are your thoughts on sort of taking in CO2 from the outside, or people being, say, stuck in a car or in a bedroom when there's no airflow.
Right.
How does it
Right.
work, sort of CO2 sort of from the outside, or is that not the solution, or is it another level? I've jumped ahead.
All right, so I'm going to be full transparency. I've never used Anders' machine, so I can't speak from experience of what it's like to actually take that extra CO2 atmospherically into my lungs. I can tell you we can recalibrate that CO2 receptor with simple breath practices, things like strong breath holds, things like reduced breathing practices that I was speaking about earlier, of teaching someone to breathe more lightly and get more comfortable with the sensation of air hunger. Okay, now I know where to go back to.
Yes.
Let's go back. Let's go back. So, what happens when CO2 rises in the body? Even simpler, what is the driver to breathe? That's the question we have to be asking ourselves. What is the driver to breathe? Most people think that you are breathing in order to take in oxygen. And you are. You need oxygen. But oxygen is not the driver to breathe. And when I say the driver to breathe, I mean oxygen is not the trigger to the respiratory centers of your brain. And it is not the thing that is triggering the chemoreceptors in the rest of your body, which is kind of modulating pH in the blood. CO2 is the driver to breathe. CO2 sends immediate warning bells to your brain and to the chemoreceptors in your body that it is time to breathe. So CO2 is running the entire respiratory show. So as CO2 increases, yeah, we get this amazing benefit, this Bohr effect of oxygen being distributed better. But think about intense exercise. When you're exercising intensely, and you can't go anymore because you just feel like you are burning inside. What is shutting down that exercise? CO2 is really increasing, and the metabolites from exercise, in addition to the CO2 increase, is making a more acidic environment. And that acidic environment is shutting down the intensity. You either have to stop the exercise completely or you have to slow yourself down. So CO2 is controlling the whole show. I don't know how deep I can go into this. Do we have some time?
Oh yeah, you can go as deep as you want because I was going to bring up acidification and you already brought it up yourself, and then the air hunger. But also, I think when you were talking about the CO2 threshold, if somebody's threshold is down here, there's a constant signal: breathe in, breathe in, breathe in, and that's sort of the way to link the CO2 tolerance to why people are taking these shallow breaths, because people don't even know that they're doing it until
Right.
somebody else points it out to them.
Right, you got it. So if my CO2 threshold just dropped here and I am breathing shallow and quickly, I am just always kind of running up against this threshold, but I'm afraid to ever go past it. How would I go past it? I would have to either slow down my breath or take a deeper breath. But as soon as I go a little bit past it, I feel the CO2 increase. I feel a more acidic environment, which are red flags to your brain. You should respond to them. But in this case, you're responding prematurely because you're not calibrated correctly. So as soon as this person tries to get their breathing pattern to slow down and back to normal, they feel anxiety, they feel panic, they feel burning, they feel like they are dying in some cases. They can't do it. So it is possible to recalibrate the breathing, but this person has to go a little bit slower and bit by bit. And they have to be very consistent with their practice in order to get back to baseline because they're getting premature warning signals, which are completely not essential. They're totally safe. It is like a false calibration. So that is the tie in there. I'm going to say, okay. And then what was the other thing that I wanted to go back to? We were talking about acidification. Yeah. So this is the other thing that will allow oxygen to dissociate. So as CO2 goes up, pH drops, right? Those always go hand in hand. And why is this important, or why does the body monitor this? your blood has to maintain it has a very small window of what is an acceptable pH in the bloodstream, right? We say around 7.35, so it's slightly towards the alkaline stage. But if it goes too acidic or it goes too alkaline, cells start to die off. So your body has this amazing buffering system to regulate your pH in this tight window in the bloodstream. So the main buffering system is called your bicarbonate system, right? And CO2 plays a huge role in this bicarbonate buffering system in order to regulate pH tightly in the body. So CO2, I almost think of it like a bit of a signaling molecule. So yeah, it's responsible for helping oxygen to be better distributed around the body, but it's also a signaling molecule and it plays a huge role in this buffering, this bicarbonate system. So if I were, we exploit this in the type of work that I do, which is sort of Buteyko and oxygen advantage breathing techniques. We exploit this by practicing really strong breath holds, and then particularly with movement, in combination with movement. So for my strong, healthy people who really want to optimize what we would call CO2 tolerance, meaning you get really comfortable with increases in CO2, you get really comfortable with feeling that acidic environment, you get really comfortable with the sensation of air hunger, right? If you really want to optimize that so that you can perform at a more elite level, you can do it with things like strong breath holds during movement. And so the way that I teach strong breath holds is that we are creating a hypoxic, low oxygen, hypercapnic, high CO2 state. And this is different from how other modalities teach breath holds. And we can do a comparison if you want quickly just to show the difference. But we're allowing the oxygen state to go down and we're allowing the CO2 to really go up. And so one of the theories here is that this helps to improve the buffering system of the body. So I expose myself to intermittent or transient exposures of really high CO2, really high metabolites from movement and exercise, a really low acidic environment. And because I'm exposing myself to that environment repeatedly in small doses, it becomes like a hormetic stressor where now when I'm not thinking about it and I'm not conscious of it and I go into a high performance situation or I'm in a really stressed situation and the CO2 starts to rise and the acidity starts to drop, my body has now become better at buffering, right? What creates acidity in the body? pH is the proportion of hydrogen in the body, right? The concentration of hydrogen in the body. And the more hydrogen ions that are running around, the more acidic we feel. And the fewer hydrogen ions, the more alkaline we are. So to improve the buffering system means your body is better at releasing buffers that grab those hydrogen ions and delay that sensation of acid in the body. And what does that look like in real world application? That means you can work more intensely or at the same intensity for longer, faster, harder, without getting shut down, without getting the breathlessness, the fatigue, and feeling that acid buildup that is so uncomfortable. So that's our buffering system, which is critically important. Now, if you have someone who's constantly blowing off CO2, the other thing that happens is their blood is getting too alkaline. And people always associate alkalinity with like good health, but every area of the body needs its particular pH to function optimally. So as this person's blood is getting more alkaline, your body is suddenly saying, oh, I don't need this bicarbonate buffering system anymore because I'm too alkaline. I don't have acid to buffer. And so your kidneys, did I lose you? Oh, your kidneys start to dump bicarbonate out in the urine. And along with it, you'll lose a lot of mineral aspects of your body too. And so there's another interesting kind of tie there with dysfunctional breathing patterns and things like bone mineral density, because you're starting to pull bicarbonate out of the bony matrix that supports your skeletal system and the mineral matrix that supports your skeletal system. So this becomes a big problem, particularly for women going through that perimenopausal, menopausal, postmenopausal stage, where they're experiencing worse sleep, more anxiety, their bones are starting to demineralize, right? It makes you wonder like, oh, is part of that a dysfunctional breathing pattern? And if we correct the breathing pattern in these women, can they start to regulate their biochemistry again and repair that buffering system that has been dumped out? So part of the reason people have a harder time recalibrating is also that they have destroyed their buffering system, right? They've peed it out and they've breathed it out. and they don't have enough bicarbonate anymore to help them buffer. So small increases in acid just feel like massive problems, massive problems. I'm all over the map. I don't know if this made any sense.
Oh, no, it did. It was brilliant because, first of all, just to backtrack to the breath holding, there's also metabolic benefits to having better CO2 signaling. Because I was going to ask you, for people who are starting to do it, how long should they hold their breath? Because I do outdoor swimming in a lake, and I've started diving underwater and swimming for as long as I can, and then popping up because I'm actually exercising. But I used to, as a child, do loads and loads of stuff like that, and we used to, and you stop doing sort of playing underwater as an adult. So that's part of it. And then I think reminding us and me about the osteoporosis link to acidity is huge. And another aspect was I'm really interested in things like hair tissue mineral analysis, and I don't want to use supplements to correct it. And what you've just said about the breathing is absolute gold, because I can test as many times as I want. And like you were saying, stress is like the biggest driver of sort of horrible HTMA tests and labs. So you've kind of it's almost read my mind of things that I was like really interested in. So I suppose for breath holding, where would people start? I mean, how long? Or is it better to hire a coach and do it properly rather than just DIYing at home?
Okay, well, I'm glad you brought up swimming because it brings up an important safety precaution that we should talk about. I agree with you because I come from a swim family, and we would go underwater and we'd be bursting, holding our breath as
Yeah.
many times as we could underneath the pool, and you're not even thinking about it as a kid. It feels so natural to hold your breath for an extended
Yeah.
period of time. It feels very natural to push yourself towards that goal of like, oh, I have to beat my older brother and do one extra lap under the water, right?
Yes.
And we lose it. We definitely lose it, and we become more fearful. Again, that fear pattern sets in, and it becomes harder to overcome the emotions that are limiting your physiology. So how can you do it? You got to go piece by piece, slowly. There's different types of breath holding. So as I said, I teach more from this oxygen advantage perspective, which is when we do our breath holds, it is hypoxic, low oxygen intentionally, and hypercapnic, high CO2 intentionally. There are other types of breathing, breath hold techniques out there, which are hypoxic, low oxygen, and hypocapnic, low CO2. So something like a Wim Hof method would be an example of this, where people are hyperventilating before they do a really long breath hold. So what is the difference? The ones I teach, you're probably going to hold your breath much less time. The acidity builds up very quickly, and it is by design because we are using it as a hormetic stressor to get a positive adaptation in the buffering system of the body so that you can perform more intensely and better. When you're doing something that blows off all the CO2, there's a lot of implications for that. First of all, I'm going to beg everyone, never do hyperventilation before they go into the water. You can absolutely cause a shallow water blackout. It's very dangerous. So right now, as we're talking about breath holding, please don't hyperventilate before you get into water. It's very common that people can die very easily that way, because you're not getting the warning bells to your brain, right? You've blown off all your CO2, and now you feel like you can hold your breath underwater forever until suddenly you can't, and you didn't get the warning signals, and now you're breathing in water. Okay, so when you take something like a hyperventilation technique and then a long breath hold, you can maybe hold your breath easily for 4, 5, 6 minutes. And so it feels very satisfying. That's also a hormetic stressor, but it has different benefits. It is not working on CO2 tolerance, which is what we're talking about here. And it's not improving the buffering system. Now, there can be immune system benefits to that. There can also just be the aspect of being comfortable, being uncomfortable, right? There's lots of benefits to that. But it doesn't serve the same purpose as what I'm talking about in terms of CO2. Also, when you hyperventilate, your CO2 drops substantially, right? So if a normal baseline CO2 is like 40 millimeters of mercury, when you hyperventilate long enough, you could drop it down to maybe 20 millimeters of mercury. That's a huge drop. Your body's not getting any warning signals. And for every, I've read an article once, for every 1 millimeter of mercury carbon dioxide drop, it's like a 2% reduction in oxygen flow to your brain. So when you're hyperventilating and your carbon dioxide drops 20 millimeters, it's like a 40% reduction in oxygen to your brain and to your heart. So this is a big deal. These are really strong interventions, and you have to have a really strong reason for doing them. If you want to do breath holding, more how I'm saying, for building up CO2 tolerance and getting the performance benefits, you got to just go slowly into your tolerance. I think it's best to work with a coach at first, but you don't necessarily have to. The way I guide my breath holding techniques is to take a normal inhale, a normal exhale, pinch your nose. Not everyone has to pinch their nose. I like to do it because it helps me to relax and regulate my pressure better. If I don't hold my nose, I feel a lot of constriction in my throat, and it's so mentally distracting to me that it shuts down the breath hold prematurely. So I like to take a normal inhale, a normal exhale. I like to pinch my nose and hold it. And then maybe I'm doing squats, as many as I can. Or maybe you're jogging back and forth. You can hold your nose and do sprints on a bike or on your feet. Just be careful if you're on a bike, you don't want to fall off your bicycle when things get hard.
Yeah.
Also, if you're practicing breath holds and you're not used to it, maybe do it in a grassy area. The way I teach breath holds, it would be very hard to black out. The CO2 is so intense, it's going to shut down the breath hold before you can push it that far. Um, how can I answer this more? You just have to kind of start to push yourself. So I would say you can start to practice maybe 3 to 5 strong breath holds a day and take about 60 seconds of rest in between each one, and build up to that for a few weeks and see how it feels and see if you notice anything. I think a good time of day to do that would be like before you're going to go do more intense exercise. So you can kind of use it as a warm up for before you go to the gym to lift weights, or before you go on a bike ride, or before you go for a run. It's kind of a nice warm up. It really heats up the body, it gets the oxygen going where it has to be going, and you're starting to work on that adaptation of better in CO2 tolerance for improved performance. I think that's a good way to go about it. Hand in hand with improving your CO2 tolerance is nasal breathing as much as possible all day, all night. Really getting the lips closed at night. Part of that is going to be working on your tongue strength and your tongue posture. And for some people, it might be mouth taping. So mouth taping has become very popular. It's like an entire industry right now. If you want to experiment with mouth taping and you've never done it, especially if you know you have some amount of sleep disordered breathing, I would say wear it a little bit during the day first, get comfortable with it psychologically, because it can be uncomfortable. And also know that they make tape that goes around the lips, which is a little bit safer because you're still able to open your lips if you have to, but the tape just encourages the muscles closed. So it's a nice proprioceptive feedback to the brain to keep the lips closed without feeling like, oh, I really can't open my mouth, right? So there's gentle ways to practice mouth taping, but getting the mouth closed at night is going to be essential. If you are breathing dysfunctionally for 8 hours every night, it's going to be really hard to see those improvements long-term during the day. And then the strong breath holds and reduced breathing exercises, like what I was describing before. That one's a little harder to walk people through without kind of coaching them. But you're really trying to take maybe 10, 15 minutes a day where you're breathing as slowly as you can on the inhale, not a shallow breath, but slow and light. So you're taking a smaller volume of breath, but you still want to encourage it deep into the lungs, right? So you don't want to lose your good breathing mechanics, but you want to take less volume of air in. So breathing in slowly, gently, quietly, really elongating the inhale as long as you can, and then exhaling through the nose slowly, gently, quietly, as slowly as you can. The more you can control your exhale, the more that's going to help to improve your CO2. Why? Because it shows your brain that you're not urgently trying to get to the next inhale, right? You're really calm. You can really relax. You can really let the air out. There's no hurry. There's no rush. There's no concern. You don't feel threatened. And then you can switch over and really control that inhale nice and slowly. That just really resets those respiratory centers as well to say, oh yeah, I'm safe. I'm in total control of my breathing. So I think those are the ways to start to approach it. Nasal breathing all day and all night, mouth taping at night if you need to. Practice 3 to 5 strong breath holds a day with 60 seconds of rest in between to get started for the next few weeks. And you can take maybe 10 or 15 minutes a day to practice this kind of lighter, reduced breathing. I think those are the 4 ways to really start to shift the CO2 tolerance and getting more comfortable with a sensation of air hunger and a little bit higher acidity in the body.
Well, that was super useful, because I think it's always nice to tie things up with something that people can do at home, like everybody needs to leave with a balloon. So I think, and it's also sort of nice to have something that's so easy to do and you don't really need anything. And you'll also feel the changes as well. And I think you've been really, really generous sharing all that information about breathing, because it's so easy just to neglect it. Or people will say, oh, I've got anxiety or I'm stressed. And people will say, oh, just go and do breath work. But they don't really know what that means. And it's nice to just have something to get started with if somebody was all brand new to this. But thank you for explaining so well the Wim Hof breathing and the hyperventilation, and then because I'm interested in your method, the CO2 tolerance. Because I was going to ask you, the world record for breath hold is something like 25 minutes. How do
Yeah.
they learn how to do that?
Yeah, it's pretty unbelievable. So I'm gonna say like the free diver community has taken breath holding to a different place.
Yeah.
Um, I have never coached anyone to hold their breath for 25 minutes. Um, so it's interesting. They do so that was stagnant in the pool, right? Just lying face down. I think that 25-minute breath hold. So it wasn't a dive. It was at the surface of the pool, and it was just head underwater, not moving. Um, they are allowed to pack extra oxygen in. And it's an interesting thing because 98% of your oxygen rides on your hemoglobin molecules. Most of it is in your red blood cells, but a little bit of oxygen can also dissolve in the plasma of the blood. And you say, well, there's only 2% room left, but breathing a little bit of extra oxygen with a mask, I wonder if it packs the plasma a little bit extra. I wonder if you can actually super oxygenate the plasma a little bit. I don't want to say that definitively because I don't even know if it makes sense, if it even makes sense mathematically. But I think you can get like a little bit of an extra boost in the blood plasma itself. Then it's exquisite mindset training. I
Yeah.
mean, that it's like unbelievable mindset training. Um, really good practice at being uncomfortable. I mean, that the air hunger is so uncomfortable. When a person's holding their breath for 25 minutes, they're going to feel their diaphragm spasm constantly, and they have tools for shutting down the spasms, sending signals to their brain that say, nope, I'm still conscious, I'm still in control, I can relax this muscle. If you have muscle tension, you're going to let go of the breath hold much faster. And once your diaphragm starts jumping, even more than the increase in CO2, that is a very uncomfortable sensation for people. Your diaphragm is unconsciously forcing you to try to breathe, and you're saying, no, I don't want to breathe yet. You're fighting with your body. So it's a big deal. So people who are just starting to learn their breath holds, go to your comfortable maximum the first few weeks and get used to it. And then as you start to practice more, you're going to feel your diaphragm jump. And it's like, can you push maybe 2 seconds beyond when your diaphragm jumped? Okay. And then you continue practicing. Can you push maybe 5 seconds beyond where your diaphragm starts to jump? And you start to build up a tolerance for it. But yeah, I mean, I couldn't tell you that person's training regimen. In the freediving world, there's things known as CO2 tables and O2 tables that you practice on land, which I have practiced too, where you're easily getting 2 or 3 minutes of holding your breath just through repetition. Basically, you get just used to it. Um, yeah, I don't know how he gets to 25 minutes.
Oh no, no, it's fine. It's just because it was something me and my friend were talking about yesterday, because he was really pleased he'd got to 2 minutes, and then we looked up the world record and it was 25. But I think it's just interesting because sometimes, like you say, it's a whole other planet. And I think just to finish off, because you touched on something really important, was mindset. So what do you do, or what kind of mindset approaches do you recommend or do or help people with?
Yeah, it's really interesting. I was never a good meditator, let's put it that way. I really like doing a breath practice. I know that meditation fanatics will argue this, but I think breath work is a form of meditation for sure. Um, just practice. I mean, I don't know how any other way around it. It just takes practice, consistency, a little discipline until you start to enjoy the process, until you can finally focus on the breath and your mind isn't distracted anymore. I actually like to count. I think it's very useful. I think it keeps the mind really centralized and really focused on what you're doing. So some people like to feel into their breath and kind of just go with the sensations in their body. I'm someone who likes to just stay really regimented. Okay, how slow do I want to breathe? Okay, let me just count it out by seconds. And just keeping the number in my head keeps me so focused on the breath. It doesn't allow the distracting thoughts to come in. So simple tactics like that, you have to kind of find what works for you, but I find counting is very useful. When you're doing strong breath holds, it's really a practice of saying, maybe having a mantra of like, I'm in control, or I'm totally safe, or I can stop this when I need to. Like you find like maybe a phrase that triggers something for you psychologically that allows you to feel safe, to know like, okay, yeah, my body's trying to breathe, but I feel okay. I can go a little longer. You have to find these tricks of something you can say to yourself that kind of self-soothes, gets the muscles to relax again, and gives you those extra few seconds. You're playing with your mind, basically. It's just like little mind tricks like that.
Oh no, that's really helpful, because I think, like you said, there's a lot of massive value in just being in the moment and just focusing on the breath and counting, and just that alone will get people a long way. But like everything, we all find our own way to work through things. So this has been absolutely fascinating. Where can people reach out to you and find you?
Yep. So I have a YouTube channel, Be Light Transformative Therapy. I think the tag is Be Light with 3 T's. My website URL is the same, belightwith3Ts.com. On there, you can find all my services, all my courses. I have a small community that I run. You can find me on Instagram at Tara Be Light. I think that's everything.
Oh, that's great. I'll put it in the link under the video anyway. And it's been a real pleasure talking to you. I've really enjoyed it. And you've shared so many useful things, and also reminded me of things I'd completely forgotten about that's so vital. So thanks so much for this. It's been really good fun.
Amazing, Sarah. Thanks so much for having me on. I hope it's valuable to your audience.
Oh, yes, it will be. Thank you very much for watching. I hope you found this useful. If you want to reach out to Tara or myself, all the links are in the description. And remember to check out my new Substack on quantum biology.